Hello everyone, from this video we are going to discuss about the femoral nerve. In my previous video I discussed about the lumbar plexus and its branches. So femoral nerve is also one of the branch of the lumbar plexus. As you can see here, this is a quick recap about the lumbar plexus. You can see the lumbar plexus which is formed in the substance of psoas major muscle. You can see the ilioinguinal nerve, iliohypogastric nerve, lateral cutaneous nerve of the thigh, then the femoral nerve here. This is the femoral nerve emerging from the lateral border of the psoas major muscle. Then anterior surface of the psoas major muscle, you can see the genitofemoral nerve, and from the medial surface of the psoas major muscle, there is obturator nerve. So the nerve roots which involves in formation of femoral nerve are L2, L3 and L4. So these are the nerve roots. You have to remember those nerve roots. Femoral nerve is also the largest branch of the lumbar plexus, and it is emerged from the lateral border of the psoas major muscle. Here you can see. Then it passes downwards in between psoas major muscle here. This is the psoas major muscle and iliacus muscle. It goes downwards in between psoas major muscle and iliacus muscle. Then it lies behind the iliacus fascia. Then it lies behind the iliacus fascia and enters the thigh lateral to the femoral artery. Here you can see it enters into the thigh lateral to the femoral artery. This is the femoral artery and it is lateral to the femoral artery. So you can surface mark femoral nerve just lateral to the femoral pulse. Also you can see it is behind the inguinal ligament as well. So what are the relations of the femoral nerve? First, it emerges from the lateral border of the psoas major muscle. Then it goes downward in between iliacus muscle and psoas major muscle. Then it enters into thigh behind the inguinal ligament and lateral to the femoral artery. After passing the inguinal ligament, after about 4 centimeters or roughly 1.5 inches, it divides into two branches as anterior division and posterior division. Here it divides into two branches as anterior division and posterior divisions 4 centimeters below the inguinal ligament or 1.5 inches below the inguinal ligament. Femoral nerve supplies all the muscles in the anterior compartment of the thigh. You have to remember that femoral nerve is not a content of femoral sheath. When we talk about the two branches, anterior division and posterior division, the anterior division gives off two cutaneous branches and two muscular branches. The two cutaneous branches are medial cutaneous nerve of the thigh and intermediate cutaneous nerve of the thigh. You know lateral cutaneous nerve of the thigh, here you can see it is a branch of lumbar plexus. But medial cutaneous nerve of the thigh as well as intermediate cutaneous nerve of the thigh are the two branches of the anterior divisions of the femoral nerve. Then the two muscular branches are one branch to the sartorius muscle. Here you can see the one branch to the sartorius muscle, the other branch to the pectineus muscle. Here you can see those two branches. Then the posterior division of the femoral nerve. The posterior division of the femoral nerve gives only one cutaneous branch. Anterior division of the femoral nerve gave two cutaneous nerves as medial cutaneous nerve of the thigh and intermediate cutaneous nerve of the thigh. But the posterior division gives only one cutaneous branch as saphenous nerve. It is the saphenous nerve. The muscular branches of the posterior division are the branches to the quadriceps femoris muscle. Quadriceps muscle. So when we talk about the saphenous nerve, which is the one and only cutaneous branch of the posterior division of the femoral nerve, it runs downwards and medially crosses the femoral artery from lateral to medial side. Here you can see the saphenous nerve here. This is the saphenous nerve here, and you can see when it descends downward, this saphenous nerve, it crosses femoral artery from lateral to medial. Here you can see femoral artery has been crossed lateral to medially by the saphenous nerve. Then it emerges on the medial side of the knee between the tendons of sartorius and gracilis. Here there are tendons of sartorius and gracilis, which is in the medial compartment of the thigh. Then the saphenous nerve emerge from the medial side of the knee between those two tendons, sartorius and gracilis. Then it runs downward along the medial side of the leg, accompanied with the great saphenous vein. Here you can see the saphenous nerve coming down from the medial aspect of the knee joint, and it goes in the leg in its medial side. You have to remember that the saphenous nerve accompany great saphenous vein. Then in the ankle region, this saphenous nerve, as you can see here, saphenous nerve passes in front of the medial malleolus. You have medial malleolus here, and the saphenous nerve pass in front of the medial malleolus and along the medial border of the foot and terminate in the region of ball of the big toe. Here you have the ball of the big toe, and the saphenous nerve terminate here. So let's quickly summarize what I said. This is the femoral nerve, the nerve roots L2, L3 and L4. Then it goes downwards in between by emerging the lateral border of the psoas major muscle, and it is go downward in between iliacus muscle and psoas major muscle. Then it crosses the inguinal ligament, behind the inguinal ligament and lateral to femoral artery. After passing the inguinal ligament, after about below 4 centimeters below the inguinal ligament, it divides into two branches as anterior division and posterior division. In the anterior division, it gives off two muscular branches as here to sartorius muscle and pectineus muscle. Then two cutaneous branches as medial cutaneous nerve and intermediate cutaneous nerve of the thigh. Then the posterior division of the femoral nerve gives off one cutaneous branch as saphenous nerve and muscular branches to quadriceps muscle. That means nerve to rectus femoris, nerve to vastus lateralis, nerve to vastus medialis, nerve to vastus intermedius. Those are the four branches to quadriceps muscle. And the saphenous nerve goes downward along the medial border of the medial side of the leg and in front of the medial malleolus, and also it goes in the foot, medial border of the foot up to the ball of the big toe by accompanying great saphenous vein. So that is the course and distribution of femoral nerve. So this is also a good diagram to quickly summarize the femoral nerve. So that's all about femoral nerve. Thank you for watching.